We reached this stage because when Alan was 69 in 2007, he was diagnosed with dementia. He became later incontinent, doubly incontinent, and his personal behaviour, when I was trying to do his personal care, became very abusive, both physically and verbally. Alan slipped in the bathroom and broke his femur. He had to go into the local hospital, and they did a very good job of mending the fracture, but they couldn't cope with his extreme behaviour. And he was then sent to community hospital, who again struggled to cope with his extreme behaviour. So I brought him home in familiar surroundings so that perhaps he would become more settled. I struggled to try and do his personal care myself, but by August of that year I could not cope anymore, and I was at very low ebb. So I took him to a mental hospital and just said I couldn't cope, whereby they took over, and even they found him difficult. They could not send Alan home from the hospital because of his extreme and aggressive behaviour, both verbally and physically, and said that Alan should go in a care home. But I said, no, he's coming home. We have a lovely home, a lovely garden, and this is where he would be more settled. And that was when I got a continuum care, met Holly, and she assessed Alan, and January of this year, 2012, Alan came out home with continuing care. And she did mention a personal health budget, and at the time it sounded so overwhelming, I really didn't want to know, but looking back now, it's absolutely marvellous. It's working very well for me. We had agency care. At first that worked out very well, but then the agency would change the carer, and we had a lovely carer, and there were problems with the agency. They took that carer away for a while until I said no, I would like her back. We did hear of a local carer that lived in the village, and from that point on I employed the local carer, and she's absolutely wonderful. She's bonded with Alan. I only wish I could have her longer, but she doesn't. She has somebody else that she cares for, so she doesn't have the time. The support broker, Debbie, came to the house, and she was absolutely wonderful, going over everything with me, which again at the time seemed overwhelming. But the carer June, she came, and Debbie, June and myself worked together, and we filled in all the appropriate forms that were required for me to employ June myself. She was the employee and I was the employer. I learnt a lot from that, because later on I employed a waking night carer, and I could then just go through what Debbie had shown me and employ the other waking night carer. Well, Alan couldn't manage any money. He can't even sign his name now. So I set up an account for Alan. It's in my name, and it's a current account whereby Oxfordshire County Council pay Alan's personal budget into there, and all the bills I pay through BACS because I use the internet banking, so everything is recorded. When the statement comes in, all the transactions are showing there. I don't have to do anything apart from send the statement in. At the end of each month I have to fill in a timesheet that is sent off to N and Payroll Department, who then deal with the necessary things for the payslip, which they send back to me. Then I pay the personal carer again through the bank into their bank accounts. Personal health budget has made a tremendous difference to Alan and my life because I'm in control. I feel that although I employ agency and a personal carer, I feel that the agency is much more amenable with me because they know that I'm in control, and they now really try hard to please me. The difference has been for Alan is that Alan is at home in his lovely house with his grandchildren that he loves. If he'd been in a care home now, he would not be the same person. So I know that my husband is getting the best possible care at home, and he's happy and he's got quality of life, and this is what the personal budget is allowing me to do. In time, perhaps I will need more carers to help me as he becomes more immobile, so I can change my carers to suit me using the budget that I've got.